Jaundice. Jaundice refers to yellow pigmentation of skin, palms, and the sclera as a result of elevated levels of bilirubin in blood. It may be visible when serum levels exceed 35 micromole per liter in adults and 100 micromole per liter in children. The symptoms and signs that accompany jaundice often provide helpful clues to the underlying cause. In children and adults, hyperbilirubinemia may result in hepatic encephalopathy. Jaundice in neonates can result in kernicterus, that's bilirubin encephalopathy. This is because of the consequences of hyperbilirubinemia on the brain of the newborn. Okay, so causes in adults. It could be from hepatitis, it could be a viral, drug induced, including allopathic and herbal preparations, also alcoholism. Hemolysis too could cause jaundice. The various causes include malaria, GSPD, that's glucose 6 phosphate dehydrogenase deficiency, and sickle cell disease. Also, allopathic drugs and herbal preparations too could cause hemolysis, which could lead to jaundice. And chronic liver diseases like decompensated cirrhosis, biliary cirrhosis, chronic hepatitis, and hepatocellular carcinoma. Liver malignancies like metastatic liver disease and also hepatocellular carcinoma could lead to jaundice, and hepatic congestion from heart failure. Gallbladder diseases, that stones or infections, could also lead to jaundice, and carcinoma of the head of the pancreas and septicemia. In children, the main causes are hemolysis and infections. Hemolysis from sickle cell disease, GSPD deficiency, and drugs, and infections from malaria, hepatitis, urinary tract infections, typhoid fever, and other septicemic illnesses. So symptoms include yellow or greenish discoloration of the eyes or skin, deep yellow discoloration of urine, itching, pale stools, among others. And the signs that are usually elicited include pallor, which may be indicative of hemolysis, chronic disease, or even malignancies. Other signs include stretch marks, indicative of cholestasis, and stigmata of chronic liver disease, for example, palmar erythema, clubbing, spider navy, and hepatomegaly, which may be tender, splenomegaly in portal hypertension, palpable gallbladder, ascites, bleeding, for example, cephal hematoma, subgaleal hematoma, and upper gastrointestinal bleeding, hepatic flap, which is indicative of liver failure. Investigations both in adults and children include FBC, that's full blood count, and INR, as international normalized ratio, normally referred to as prothrombin time, that's PR or PT, and sickling status, GSPD status, that's glucose 6 phosphate dehydrogenase deficiency status, and blood film for red cell anomalies, malaria parasites, liver function test, urea and electrolytes, hepatitis screening, as HB surface antigen, that's SAG, and hepatitis C virus antibodies, hepatitis A IgM, hepatitis E IgM, also blood culture, urinalysis, abdominal ultrasound, and abdominal CT scan. For the treatment, the main treatment objectives are to identify and treat the cause of jaundice, also to relieve symptoms associated with the jaundice, and to prevent complications associated with elevated levels of bilirubin in the blood. Non-pharmacological treatments include avoiding alcohol and other hepatotoxic agents, and also ensuring adequate hydration. Pharmacological treatment. So, cholestatic jaundice with severe pruritus while investigating for underlying etiology. You could give cholestyramine oral as first line treatment in adults, 4 grams 12 hourly. Tighter dose to response and tolerance with a maximum dosage of 16 grams per day. In children and adolescents, you could give 2 to 4 grams 12 hourly with a maximum dosage of 8 grams per day. Referral criteria: refer patients with unexplained jaundice to a specialist for further evaluation and management.